Right now, inside your body, a silent conversation is happening between your heart, your kidneys, and your blood vessels. Most of the time, you never think about it. But here's what most people don't realize. That conversation can start going wrong years before a single symptom appears, years before any diagnosis, years before anything shows up on a doctor's screen. And by the time that number finally comes back high, a lot of that silent damage has already been done. Today, we're going to change that. By the end of this video, you're going to understand something most people never get explained to them clearly: how your body actually controls blood pressure, why that control system slowly breaks down, and 6 specific research-supported steps that may help bring it back toward a healthier range, naturally. No extreme diets, no miracle claims, no confusing medical language, just clear, honest science, explained simply. Let's start from the beginning. Think of your body's circulation like a closed plumbing system. You have a pump, that's your heart. A network of pipes, those are your arteries and blood vessels, and fluid constantly moving through them, that's your blood. Pressure inside that system depends on 3 managers. First, the heart, how hard and fast the pump is pushing. Second, the vessels, how wide or narrow the pipes are. Third, the kidneys, how much fluid is inside the system at any given time. Your body manages all 3 of these automatically, and it does it constantly, every minute, every hour, every day. When pressure drops too low, sensors inside your arteries detect it immediately. They send a signal to your brain. Your brain responds by speeding up your heart, tightening your vessels slightly, and telling your kidneys to hold on to more fluid. Pressure goes back up. When pressure climbs too high, the opposite is supposed to happen. The heart slows slightly, the vessels relax, the kidneys release more fluid, pressure comes back down. It's an elegant, self-correcting loop. But here's where it gets interesting. That system, as brilliant as it is, can be slowly pushed out of balance, not dramatically, not all at once, but quietly, over time, through patterns most of us repeat every single day without ever realizing it. And when that happens, the body stops self-correcting the way it used to. So what actually goes wrong? Let's start with your blood vessels. Healthy arteries are flexible, like rubber hoses. They expand slightly when blood rushes through them, then gently recoil. That flexibility is what keeps pressure stable between heartbeats. But over time, especially after age 40, those vessels can start behaving more like stiff garden pipes. The inner lining of your arteries normally releases a natural chemical signal that tells the vessels to relax. When we produce less of it, the vessels stay slightly tighter than they should, and tighter vessels mean higher pressure. Think about it this way. Squeeze the same amount of water through a flexible rubber hose versus a rigid pipe. The rigid one builds pressure much faster. That's essentially what starts happening inside aging or stressed arteries. Now add the kidneys. Your kidneys act like your body's volume control, and their most important job is managing sodium, because wherever sodium goes, water follows. If your kidneys become what researchers call salt sensitive, they pull extra water into the bloodstream to balance that sodium. More fluid in the system means more pressure pushing against the walls of every vessel. And this doesn't happen overnight. It happens gradually, day after day, year after year, often without a single noticeable symptom. Then there's your nervous system. Your body has a built-in emergency response, what most people know as fight or flight. Short bursts of it are completely normal, but chronic stress, poor sleep, carrying excess weight, or untreated sleep disorders can keep that emergency system slightly activated all the time, like an alarm that never fully shuts off. And when that happens, your heart works a little harder than it should, and your resting blood pressure slowly drifts upward. Here's the part that matters most. None of this feels like anything. There's no pain, no obvious signal. Life feels completely normal. But inside the vessels, the pressure is quietly building, and research consistently links sustained elevated blood pressure to higher long-term risk of stroke, heart attack, kidney disease, and heart failure. Not because of how it feels, but because of the steady mechanical stress it places on the body over years. Now here's what I want you to understand. Everything we just covered, vessel flexibility, fluid volume, nervous system activity, these aren't just problems. They're levers. And when you know which lever does what, you can start to influence them in a meaningful way. That's exactly what comes next. Lever 1, reduce excess sodium. This one directly targets the fluid volume problem we just talked about. When your body takes in more sodium than your kidneys can efficiently clear, it holds extra water to keep things balanced. That extra fluid raises the total volume inside your blood vessels, and more volume means more pressure. Large population studies have found a consistent link between higher sodium intake and higher average blood pressure across dozens of countries and millions of people. Here's the practical part. The biggest sources of excess sodium in most people's diets aren't the salt shaker at the dinner table. They're packaged foods, processed meats, canned soups, fast food, and restaurant meals. Simply shifting toward more whole, minimally processed foods can meaningfully reduce the sodium load your kidneys have to manage every single day. Research suggests this shift may support a noticeable reduction in your top blood pressure number, particularly for adults who are already reading high. Lever 2. Bring in more potassium through real food. Potassium is sodium's natural counterpart inside the body. It helps your kidneys flush out excess sodium rather than hold on to it, and it supports the muscle cells inside your blood vessel walls, encouraging them to stay more relaxed rather than tight. Foods like leafy greens, beans, lentils, avocado, and certain fruits are all naturally rich in potassium. The well-researched DASH dietary pattern, which emphasizes vegetables, fruits, whole grains, and lean proteins, has been shown in clinical trials to produce meaningful blood pressure reductions. A significant part of why it works is that it naturally raises potassium intake while reducing sodium. One important note: if you have kidney disease, please speak with your healthcare provider before significantly increasing potassium. When kidney function is reduced, potassium levels need to be carefully managed. This is a conversation worth having with your doctor before making changes. Lever 3. Support a healthier body weight. If that applies to you, this one needs context because not everyone with high blood pressure carries excess weight. These are not the same condition. But excess body fat, particularly around the abdomen, is not just storage. It's metabolically active. It releases signals that increase nervous system activation and promote low-grade inflammation in blood vessel walls. That chronic biological stress can keep blood pressure higher than it would otherwise be. Research suggests that even modest weight reduction, around 5 to 10% of body weight, may produce a meaningful improvement in blood pressure for those whose hypertension is connected to excess weight. The goal isn't a specific number on a scale. It's reducing the biological pressure that excess body fat places on your cardiovascular system over time. Lever 4. Move your body regularly. This one works directly on the vessels themselves. When you do sustained aerobic movement, walking, cycling, swimming, anything that keeps your heart rate elevated consistently, blood flow through your arteries increases. That increased flow creates a gentle, stimulating effect on the inner lining of your vessels. And that stimulation encourages the production of that natural relaxation signal we talked about earlier. More of it means more vessel flexibility and lower resistance. Over time, regular aerobic activity also trains your nervous system to stay calmer at rest. Your heart becomes more efficient. Your vessels become more responsive to the signals telling them to relax. Major cardiovascular health organizations reference regular aerobic exercise as one of the most well-supported natural approaches to blood pressure management, with research suggesting consistent practice may reduce systolic pressure by several meaningful points. And here's what I want you to hear clearly. You don't need extreme workouts for this benefit. Consistency is what creates the change. A daily 30-minute walk is a genuine cardiovascular intervention, not a consolation prize. Lever 5. Be honest about alcohol intake. This one surprises a lot of people. Regular high intake of alcohol activates your body's stress hormone system. It reduces the accuracy of your internal pressure sensors, the ones designed to catch rising pressure and correct it. And it significantly disrupts sleep quality, which connects directly to the next lever. Research suggests that meaningfully reducing regular alcohol intake in people who drink frequently may support a noticeable reduction in blood pressure over time. This isn't about perfection or total elimination for everyone. It's about recognizing that what feels like relaxation in the moment can quietly be elevating your baseline pressure when it becomes a consistent daily pattern. Lever 6. Give your body its nighttime reset. Here's something many people never hear explained. Under healthy conditions, blood pressure naturally drops during sleep. This nighttime dip is part of your body's built-in restoration process, a window where your cardiovascular system gets to recover. When sleep is chronically shortened or disrupted, that dip disappears. Blood pressure stays elevated around the clock, including during the hours when it's supposed to be recovering. Chronic poor sleep also elevates cortisol, a stress hormone that encourages both fluid retention and vessel tightening. Two things that directly raise pressure. If you've been told you might have sleep apnea, a condition where breathing briefly stops repeatedly during the night, this is worth addressing seriously. Research shows that treating sleep apnea can support meaningful blood pressure improvements, particularly in people whose pressure has been difficult to manage through other means. Managing ongoing stress matters here too, not through ignoring real problems, but through consistent habits that give your nervous system regular windows of genuine calm. That might look like an evening walk, a short breathing practice, or simply protecting your sleep schedule. Small habits, practiced consistently. Now, a realistic and important note. Some people implement all 6 of these steps and see significant improvement. Others see modest improvement, and some need medication alongside these changes to reach a healthy range. That is not failure. That is biology. Blood pressure isn't a single disease. It's a final number produced by many interacting systems: genetics, kidney function, arterial structure, hormonal patterns. These all influence how much any lifestyle change can move the needle for a specific person. What research does consistently support is this: these 6 levers are additive. Each one targets a different part of the system, and even small, steady improvements across multiple areas can accumulate into something clinically meaningful over time. If you're currently taking blood pressure medication, please don't adjust or stop it without speaking to your healthcare provider first. Lifestyle changes can be genuinely powerful, and that's exactly why they should be monitored carefully alongside any existing treatment plan. Everyone's body responds differently. Work with your provider, not around them. If everything we covered today makes sense but feels like a lot to organize on your own, that's completely understandable. Knowing the levers is one thing, building them into real daily life is another. That's exactly why we created the 30-Day Blood Pressure Reset Foundation. It takes these 6 areas and turns them into a simple, structured daily plan built specifically for beginners. You'll find DASH-style meal guidance, beginner-friendly walking routines, resistance exercises like wall sits and planks that support vascular health, progress tracking, and practical daily habits, all grounded in what the research actually supports. No extreme changes, no overwhelming schedules, just one clear day at a time with direction. If that sounds like the kind of support you're looking for, the link is below. Take a look and see if it's the right fit for where you are right now. Here's what I want you to take away from today. Blood pressure isn't something that simply happens to you. It's the output of a system, one that you have real, meaningful influence over through the choices you make consistently, day after day. You don't need to be perfect. You don't need to overhaul your entire life this week. You just need to start moving the right levers, gently, steadily, and with patience. Your vessels respond to movement. Your kidneys respond to what you eat. Your nervous system responds to rest. And small changes, repeated consistently, have a way of adding up to something that genuinely matters. It is never too late to start supporting your health. If this video helped things make sense in a way they didn't before, consider subscribing. We cover heart health, blood pressure, circulation, and longevity every week, always in plain language, always grounded in real science. Take care of your heart. It's been working for you every single second of your life.